Public health is inarguably a critical component of every military operation. Public Health Command Atlantic supports the public health enterprise through our veterinary services and technical services. Technical services consists of laboratory sciences, entomological sciences, industrial hygiene, and environmental health and engineering. DAPAM 4011, the Army Public Health Program, tasks Public Health Command Atlantic to provide oversight, operational guidance, mentorship, technical assistance, and consultative services across our entire area of operation, consisting of 26 states on this half of the country, Cuba, and Puerto Rico. Through this, we not only ensure readiness for the warfighter, we ensure the safety of the community.
So this was an operational public health assistant visit, formerly known as a technical assistant visit. And so basically we were providing training to the 794th Preventive Medicine Detachment to allow them to practice their garrison-based mission in an operational setting, so in the field, to prepare them for deployment.
The first 5 days we gave them didactic training, and the last 5 days what we did was we actually took them in the field where we assess their capabilities and competencies and see how well they are going to do once they deploy.
And we did soil sampling, so we got these little containers that we packed up with soil. We had these water samples that we did, and we're testing the water to make sure that there's no pathogens, no bacteria in the water that the soldiers may or may not consume, the water that the soldiers might even interact with on their skin, simple things like that for the shower, hygiene. And then we did air sampling to make sure that the air quality was good enough for our soldiers to be in, and if it wasn't good enough, how could we recommend ways that we can help mitigate those risks to our soldiers, and whoever else is going to be in that environment is safe.
A lot of times a 68 Sierra is assigned to other tasks. Our value isn't intrinsically known as, the value of supply or these other MOSs, these other parts of the Army. For that, I think what we need to do is become more vocal about what our actual job is and make it known to commanders, learn to speak that language better. We can get these trainings on how to use the equipment, we can get these trainings on what life is like in the field, how to do our job in the field, but learning more how to discuss our role in the Army and how to be more vocal about it, how to make it more well known, is really going to be the driving factor that makes 68 Sierras more successful in the future.
Our #1 mission is to support the warfighter, to ensure that the level 2s, the level 3s, when they go into their austere environments, that they are prepared. We provide them health risk communication, we provide them training through our operational public health and technical assistant visits. We ensure that Preventive Medicine Detachment or that 2-man team of the 68 Sierra, the 72 Delta at the Brigade Combat Team is fully prepared to ensure soldier readiness as well as their combat effectiveness is not affected by the environment which you're deploying into.
I think the training really does set us up for success in a deployment environment. It's not so much about just giving us the answers now, but teaching us how to find the answers when we're in a situation where we might not recall exactly what to do. So it sets us up for success in terms of here's where you can find those answers, here's who you can reach out to for those answers.
People don't realize our importance until something really does happen, and so when something happens in that environmental health parameter or public health parameter, then you have to start practicing your reactive.
When it comes with preventative medicine, we ensure that we identify the health threats and provide the mitigation to maintain combat effectiveness.